Hey everyone, welcome back to the Revenue Cycle Decoded podcast. I am your host, Gina Cornett, and we are breaking down all things revenue cycle. If you have ever felt overwhelmed by the complexities of the revenue cycle, you are not alone. It is very complex, and it is a critical process that keeps healthcare organizations running smoothly, but it can also be a source of stress and inefficiency for your team. The good news, simplifying the revenue cycle is not only possible, but it's actually essential to drive better results and ensure your team can work efficiently and effectively. So, in today's podcast, I am going to cover 5 practical strategies to help you simplify the revenue cycle process for your team. Let's dive in. First up, let's talk about the power of standardization. One of the quickest ways to reduce complexity in the revenue cycle is just by creating clear, standardized procedures that everyone on your team can follow. When you standardize procedures and workflows for tasks like patient registration, coding and billing, documentation, you can ensure that everyone is on the same page. This helps to reduce confusion and it minimizes errors and helps to maintain consistency across the entire process. Now, I will tell you, when I was working as a practice manager and my front office person left suddenly, I had to now take over the front office role. And it would have been so helpful if at that time I had had all of the front office procedures standardized and written down so that I knew what to do. So this just is an example of what can happen if people in your practice or your organization don't have standardized procedures to follow. Now, as an experienced practice manager and revenue cycle leader, I definitely would have had all of those front office processes written down in a binder so anybody could have sat at that desk and known exactly what to do. So this brings me to my next point. You want to make sure to document these procedures and provide regular training to keep everybody aligned. And don't forget to review and update your workflows regularly, not only to stay compliant with new technology or new procedures or new payers requirements, but also to make sure all of those workflows are compliant with the latest regulations and best practices. Now let's talk about how technology can make your life a lot easier. Automation is a game changer when it comes to simplifying the revenue cycle. Consider using automation tools to handle repetitive tasks like billing, coding, claims management. More and more, we are seeing talk about AI and machine learning beginning to take over some of these processes. And I've read some great use cases of how revenue cycle teams have used AI or machine learning or prompts in their technology to be able to handle some of those processes that can be very inefficient and require significant manual time. So things like payment posting, reconciliations, posting of refunds, etc., all of those things, even answering your denials, right? How much time does that take to research your denials and research the medical policies and then write those letters? So AI and machine learning can even be used to handle those processes and to be able to file those appeal letters with the payers to make sure that your organization gets paid and remove that manual process from your team. So any software that you can find and that can automate those processes can really significantly reduce the risk of human error, speed up your workflows, and free up your team to focus on more strategic tasks. So now let's talk about training. The healthcare industry is constantly evolving, as you know, and keeping your team up to date is crucial for maintaining an efficient revenue cycle. Regular training teams regular training sessions help to ensure that your team is familiar with the latest coding changes. Remember, we get updates every year on CPT and ICD-10 and HCPCS coding changes. So we need to make sure our teams are aware of any of those changes that apply to them. We get annual updates if we're billing for facilities on our inpatient and outpatient prospective payment system from CMS. We get an annual update on the Medicare physician fee schedule. There's also annual updates on home health billing. And all of these updates will tell you about all of the regulatory changes that CMS has planned for the coming year. So make sure you're aware of those and that you are training your team on anything that they need to be aware of that's going to change as far as regulation or policy or coding. This not only reduces the risk of errors, but also boosts your team's confidence and efficiency. Another area to consider regular training sessions is between your back end revenue cycle and your front end revenue cycle and your middle revenue cycle. Make sure those teams are talking and that your back end, for example, is training the front office people on what they're seeing on denials or errors in claims information, and vice versa. Your front end revenue cycle can be training your middle revenue cycle about things like authorizations. So identify those key people that are responsible for those processes and let them cross-train across your team and your organization. Cross-training team members on different aspects of the revenue cycle helps you to create a more flexible and a collaborative workforce, as long as you avoid the blame game. And remember that a well-informed team is a more efficient team. Another key strategy is fostering open communication across departments. Your revenue cycle, even in a small office, involves multiple teams, and effective communication is essential for keeping everything running smoothly. Encourage regular meetings that bring together representatives from patient access, coding, billing, and collections, and let them discuss challenges, share updates, and align on goals. Creating cross-departmental committees, if you are in a larger organization, can also help to improve collaboration and ensure everybody's working toward the same objectives. And there are communication tools like project management platforms and team chat apps that can facilitate that real-time collaboration. And lastly, let's talk about monitoring and adjusting your processes regularly, because even the best designed workflows need to be reviewed and refined over time. Keep an eye on your key performance indicators, such as your days in accounts receivable, your denial rates, your collection efficiency, because that will help you to identify bottlenecks and areas for improvement. Conduct regular audits of your revenue cycle processes to make sure everything is functioning as intended, and make adjustments when needed. If you are running an audit on the information that's collected and entered into your patient billing system on your patient demographics, be sure to adjust the processes if things aren't being captured. If your front office people aren't asking their patients for updated demographic or insurance information, this is a clue that you need to go in and retrain or perhaps adjust that workflow to make sure that that information is captured like it needs to be. So make those adjustments as your audit processes and your reviews identify areas for potential improvement. So there you have it, 5 practical strategies to help you simplify the revenue cycle process for your team. By standardizing procedures, leveraging technology, investing in training, fostering communication, and regularly monitoring your processes, you can create a smoother, more efficient revenue cycle that benefits everyone involved. Remember, simplifying the revenue cycle is going to make things easier, but it's also going to empower your team to work more effectively, and it's going to help you drive better results for your organization. So if you found this video helpful, be sure to give it a thumbs up and subscribe to the channel and hit that notification bell so you don't miss any of my future content. If you have any questions or tips of your own, I'd love to see them. Please drop a comment below. Thanks for watching and see you next time. Peace out.